Welcome to InMore Clinical Conversations,
where knowledge meets practice and confidence is built through clarity.
Powered by InMore Medical, this platform exists to elevate how we learn, share, and apply medical knowledge. In a field that constantly evolves, staying informed isn't just an advantage, it's a responsibility.
More than a discussion series, this is a space for insight, collaboration, and better standards of care. I'm Dr. Grace Canilang.
And I'm Doc Phoebus Carranza. Welcome to our first episode of Evidence-Based Personalization.
So, Dr. Phoebus, this is our first episode. I'm very excited. How about
exactly.
you?
It's our first episode for InMore Clinical Conversations.
Yes.
I'm really excited for this, Dr. Grace.
Same. At alam ba na, hindi tayo nag-usap pa.
Yes.
Adidas, baka naman.
Adidas, baka naman. Peace lang. So, my name is Phoebus. So, the origin of my name is, if Greek mythology, Phoebus Apollo, god of archery. And if it's from Norse mythology, god of the sun. So, my specialty is aesthetic and clinical dermatology, as well as lifestyle medicine. And lastly, anti-aging and regenerative medicine. Because I love my patients to age better, live better, and have the best quality of life possible in this lifetime. I also love my patients to accept their age, but not feel and look their age. So that's my goal,
Correct.
why I entered aesthetic medicine.
I entered aesthetic medicine. Primarily, first, I'm an OBGYN. And as you all know, I love surgeries, no? However, there's sometimes that, alam mong, kulang eh.
Yes, yeah.
So I further studied for aesthetic medicine and then furthermore for cosmetic surgery to build a non-surgical and surgical treatment
Yes.
for each patient because lahat yan ay iba-ibang
Yeah,
cases.
agree.
And I agree with you that we love aging but we don't
Yes.
want to look our age per se.
Yeah. 10 to 15 younger than our actual age, I think that is good enough.
Yes, very, very much. And then tama yan. For nowadays kasi, everything is towards to wellness
Yes,
and
exactly.
holistic approach.
Holistic approach.
In my case, to be honest, is, I per se is one, meet a lot of pages ranging from 20s, 30s, 60s, even 80s. Would you believe?
Yeah.
O kahit na 80s yan, magpapaganda na yan. Now, kasi po ngayon, I think it's more on not vanity, but it's more on self-love
Yes,
and
exactly.
self-care. No? So, mas aware na po tayo, pwede naman pala eh. Why
Yeah.
not naman? So, kaya dapat po ay personalize siya or individual kasi iba-iba ang gusto ng outcome ng tao. Okay?
Yes.
And that's one. May iba, Doc, I want more subtle lang. I want more drastic. I
Yes.
want more ganito, ganyan. At least you meet halfway and you presented ano po yung mas babagay. Then I think that's the best way to give the patient the best result and outcome.
Yes.
How about you, Doc?
Agree. Always listen to your patients and you meet them halfway. So for me, I totally agree with Doc Grace. I love to listen to my patients. I always ask questions. What's your goal? How do you see yourself 10 to 20 years from now? How can I help you with your journey as you age? Because my goal for my patients is for them to age gracefully. So I couldn't agree any better than what you have said, Doc Grace.
Correct.
Aging gracefully.
Yes.
I totally agree with it.
Ako kasi, I avoid mistake.
Yes.
Dapat when you do it on the first time, tama na po lahat. Why? Because these are the chances that patient would come to you and come back to you. And we want quality patient. When you say quality, these patients don't shop on over the clinic.
Yes.
Ikaw at ikaw ang hahanapin.
Yes.
Diba? How about you?
I agree again. Proper assessment is the
Yes.
key. Always ask questions and always meet them halfway. And you also want to educate your patients why you are doing certain procedures for them to achieve the maximal goal that they can achieve per treatment.
Because kasi when you say one size fits all, hindi siya ganun eh. Aesthetics not like that. And at first, kung mapaprevent mo na yung ayaw nating disadvantage outcome, then less ang sakit ang ulo ng aftercare treatment.
So safety is important.
Yeah, so
for the
prevention
patient.
is the key.
Yes. And also for the doctors, you don't want a headache.
Yes.
Any headaches, we try to avoid that as well.
In practice, it depends. Because as you all know, we have different kinds of face shape.
Yes.
We don't have a different anatomy,
Yes.
genetics, no? So that all comes into consideration.
Yes.
So kung ano yung dapat, as long as you know the product that you're using, you'll never go wrong.
Yes, because I agree, male and female have different goals. Let's say for female, they're more likely to want that heart-shaped triangle of youth. I call it the inverted triangle because you want lifted cheeks, contoured face, heart shape. So while for men, you want a broad chin with the square-looking jawline. So you want those sculpted angles of your face.
Yes. Pero
So-
important is tatanungin pa din, ano ang
Yes.
goal mo?
Always
What's your goal?
ask.
Because there are a lot of men, a few men, in my practice that, ang tatanong ko, what do you want ba? Stronger jawline like Piolo Pascual look?
Yes.
Or Inigo Pascual yung dating,
Yeah.
ganon. But some naman, no, I like a V-shape. So,
Yes, yes.
not lahat, they want squarish na masculine look. May iba kasi feminization. Dapat, in your consultation
Yes.
pa lang, nagkakaintindihan. Dapat one goal kayo. And then I always ask, gets mo mommy? Or gets mo dad? Gets mo sir? Ganon.
Yeah. And I always ask, do you want subtle or drastic changes? And I love my patients to do a journey with me because sometimes one treatment is not enough to achieve a certain goal. It has to be a process. So it would take time for them to
Actually,
achieve the
for
final output.
anti-aging medicine, there's no such thing as one-time big time.
Yeah.
It should be a series of
Treatments,
sessions and
sessions.
treatment. Yes, definitely.
yeah.
As long as your goal and objective with the patient is the same. Kunyari, pag sabi niyang, Doc, I want this. But naman, it's way impossible to do for the face shape na
Yes.
ay ganon. So, you have to retrieve it. Oh, ma'am, I cannot do like this, but better.
Yeah.
Because, in aesthetic medicine, the best way is what? You retain the natural beauty of a person. And then you just
Absolutely.
elevate whatever yung kaya. But you don't change it. The word change is different.
Yeah.
You just want to be more on natural looking and safe way.
The better version of you.
Yun,
So
ang perfect.
always respect the anatomy.
Yes.
And of course, we have to still be aligned with, of course, the patient structure, the patient's goals, end goals.
Yeah. For example, kunyari sa lips, okay, magpa-lips ka, and then she's already 60 years old. Alangan naman you put a lip of 18 look like years old. So we don't do that.
Yeah.
We do age-appropriate treatment. So pwede pa rin magpa-lip fillers, pero age-appropriate
Yes.
for 50, 60, even 80 years old, I do it.
Education is key for you and the patient. Ako for me, for non-surgical treatments, definitely threads and fillers would give you a drastic change or subtle change right away. Like from the first session alone, it would give you that change. But while for more of like biostimulating or skin booster type of treatments, or even lasers or energy-based devices, it would take a while. It would take a while for you to stimulate your collagen, improve your overall skin quality, and what people always want, that dewy, glowy, luminous look.
Dewy skin, Korean
Dewy
glass skin.
Healthy skin.
Healthy skin.
Yeah.
For me kasi naman is, actually it depends if it's first timer, no? Kasi a lot of patient now, they are into na sa injectables. Iba kasi takot eh. So, for example, they would just like to try Botox in one area. So you do one area.
Yeah.
And then after 5, they love it. Then they go.
Uh-huh.
And then you just presented your assessment at ano-ano pa yung mga pwede.
Yes, you ease the patient in
Yes.
doing it gradually because sometimes
Hindi mo sila bibiglain na, oh, ma'am, eto na gawin mo lahat.
Yeah.
Once, no, lalo for a first timer, they can't do that.
Yes.
So you appreciate anong limitation ng patient. And then once they're comfortable with you, I'm very, very
Yes.
sure they're going back for you.
and once
Over
they,
and over again. Because why? There's no such thing as forever, especially non-surgical.
Oh,
So pag
yes.
weighing off na yung Botox, your fillers, definitely, they will come back to your clinic.
it's those little things that matter when doing treatments and when explaining it to patients.
Lahat sila kasi memorable eh. Like, there's these 50s na kakahiwalay lang, and then, when we started her journey, ngayon, ang boyfriend niya, 20s, ganyan, pa nagkakwento. So, you feel happy pag ganun. Tapos, ang dami ng suitor daw niya. So, you feel happy kasi nakakaboost ka sa self-confidence nila.
For me, let's say a patient would consult with me and would tell me like, oh, I have a big event 6 months from now. I'm excited for that. 6 months to 1 year from now. Why? Because I'll be able to do a protocol for that patient. Let's say,
Yes.
let's improve your skin quality while doing Botox at the same time, especially for women who have enlarged masseter. They really love having Jotox done. So while you're doing Jotox, I also do a modified Nefertiti lift and some slimming effect products such as Mesolipo,
Yeah.
specifically lemon bottle for my patients.
Segue.
Yeah, right?
Segue, yeah.
Insert a brand.
Yeah, me naman, I start always from the face and then down. Pag na-achieve mo na, and then I don't stop. We don't stop. I don't stop in one patient.
Yes.
For one patient, everything's, ano yan, meron siyang mga assessment for, oh, mom, tapos na tayo sa face. Oh, next natin
Yeah.
the neck. And then the hands, and then the body. It depends sa budget.
Yes,
Budget-wise.
budget.
You also all have to
Always
be,
respect that.
yeah, respect mo yung budget ng patient. Dok, ito lang kaya natin. Okay, let's do this by
Yes.
segment. But you don't, parang hindi mo siya babaguhin yung assessment mo and your plan. You stick with your plan for your anti-aging medicine, but sa budget-wise, okay, let's do this first, and this, and that,
Yeah.
and then, that's it. Kaya
Yes,
ang
yeah.
patient will keep coming back for you. That's
Yeah.
for sure.
Respect what's comfortable with them, because you cannot just bombard them with a lot of treatments and they're not capable
Comfortable,
of,
yeah.
in terms of finances, they're not capable for it.
Yeah.
And of course, in terms of downtime as well, you always have to explain.
Yes, downtime. That's a very
It's essential.
good. Yeah, it's very, very. Yung iba kasi they don't say na, oh, I have a flight. I have a party, like those things. You have to say na, oh, the downtime is more or less a week or 2 weeks. So at least they have a knowledge. Oh, I cannot do this pala. So what can you do? Dapat you have to have a rescue treatment ang tawag ko doon. Oh, aalis pero kailangan. So you have a rescue treatment,
Yes.
which a lot of product that InMore has.
Yes. I love InMore products. Don't you agree, Doc Grace?
Oo, kasi from may mga downtime from COG, I have a lot naman for mga
Yes.
Glow series kasi less than downtime ng mga
Yeah.
Glow series.
Like, we can never stop talking about InMore products.
No.
On and off cam.
Me, my favorite is of course is the salmon DNA. You know, yeah,
Yes,
it's very very popular nowadays. And I started 2023 when we first introduced Crystal PN in Philippines. Kami nag first lecture
Yes.
sa PPAI. Yeah, from that 2023 lecture. And then from there, I've been using it non-stop for the eyes, face, everything. Very, very nice. Then from there, nag-start na ako then use other products from Glow
Yeah.
series. Their Elitox is very, very nice. One of the Botox, nice. And fillers, the Avalon fillers. And their Valencia COG. So, ang maganda kasi sa InMore, they never stop innovating
Yes.
products. And costly-wise, very nice for doctors and patients also.
Okay, that's so nice.
Oh, yung
Doc
lemon
Grace.
bottle sa'yo na.
Okay, okay.
I give the floor to you with lemon bottle.
Okay, since it was mentioned, so I would start with lemon bottle. So we have lemon bottle, the Mesolipo, and we also have the lemon bottle reboot. So both of these products of lemon bottle, I love it so much because you can cater to the different needs of the patient. But in terms of skin quality, I couldn't agree any better than what you just said. The salmon
The
DNA,
salmon
the
DNA.
polynucleotide,
Very
it really gives amazing results, like really amazing, mind-blowing.
Oy, one mind blood. Pero totoo yun.
Yes, I mean, it may seem exaggerated, but it's really mind-blowing, especially if they follow the protocol. Let's
Very,
say
very nice.
if they do it like for 2 to 3 sessions, or even more, up to 4, really good results, amazing results.
Oh.
Ay, that's
Yan
a good
ang
question.
Yes. Dapat pagka-consult pa lang, may red flag na. You
Yeah.
know when you know. So, when you know they keep on insisting, Doc, I want this, I want it, and pero way too impossible
Yes.
to, to give. Explanation talaga
Yes, yes.
And education to the
Education.
patient is the best.
When I encounter patients, like when, let's say, you are given like a super short time frame for you to achieve this amount of work, I wouldn't proceed. Like, unrealistic expectations. My goal is to educate the patient, and if we can't meet halfway, I rather say, no, I think I'm not the doctor for you. I'm not fit for
Yan
you.
yung aking din, Mom, baka I'm not a doctor for you for your case.
Yes.
Baka probably you can say. But at least they appreciate it when you're very
Yeah.
honest with
Yeah.
it. It's not because of business, because you care.
Yes,
That's
we
the
care.
one thing. You care for your patient. You want your patient to go back to you as, parang kasama na ka na yan sa kanyang mga budget list.
Oh, it's like becoming a family member of yours.
Oo, ganyan.
What you like for your family members, you also wanted to do it for your
Kasi
patients.
nakakatuwa sila kung sasabihin, Dok, alam mo ba, kasama ka na sa notebook ko. Kasi ibig sabihin, nakaano ka niya
Dok, pag naalala rin yung mga special events in your life,
Oo.
like giving you gifts, or even a token of appreciation
Oo.
after the follow-up, or just let's say they drop by the clinic and gave you
yes.
something, nakakatuwa.
Ang
Nakakataba ng
very
puso.
much natutuwa ko is what? Referral. You know,
Referral.
mga, lalo na pagka out of the
Pamilya na
country,
nila.
Dok, sabi kayo po ang hanapin eh.
Oh, wow.
You know, uy.
Kilig.
Kilig ba?
Grabe. I mean, 10 out of 10. Kung pwedeng
11 out of 10.
Pwede nga, 11 out of 10.
Oo.
Education is really important because that would be the baseline of every consult that you'll be having.
That will be your baseline. Sa consultation pa lang, you should know na, oh ma'am, this is the botox like that, ganyan. Fillers is like that. It's not for this. Because marami kasing, sorry for the term of Dr. Google, di ba?
Yes,
They just
yes.
keep on, watching their TikToks, YouTube, whatever. So, at least you educate them. I tell them, I respect what you're watching. I'm not against anything them. Kasi yun ang kanilang, that's their business or what. But, if you want something, professionally guided,
Yes,
then
professionally guided.
dito tayo.
Because we value safety.
Yeah. Safety
Right?
is the very, very much
Our important role of
Yeah.
doctors. And of course, we want to educate our patients that maybe they're only looking at it at one side of the coin. So it's our duty to educate them.
Yes.
That maybe they're not seeing the whole picture, the bigger picture.
But most of the
things.
time, most of the, kunyari out of 10, 9 of those really would appreciate na, nga, Dok, tama yung sinabi mo.
Especially when they start the first session of the procedure
Yes.
and they see results. Nakakatuwa na, oh, doctor, you're right. I'm so happy about what I did and listen to you
Yes.
afterwards.
Agree.
Agree talaga.
Me is safety. Bakit kailangan ganun po, doktora? Because ang personalization, it doesn't mean that idol mo si ganito and
Yes.
then you should be the same thing. You are a very unique individual. So if you're unique, you know that you have your potentials and you have your own beauty.
Yes.
So yung own beauty mo, yun ang i-recreate natin for your balance and harmonization of your face and body, kung ano man ang concern ng patient.
So for me, for personalized aesthetics, each one of us is unique. So for each patient, the approach should be individualized. So let's say for me, I see the most important thing for you right now at this moment is skin quality. I would address that first. Then as we do the journey together, then we'll be able to have a consult with you again, another assessment, then we'll do other modalities to make you the better version of you. Actually, I think next time we can share about our personal journeys together, like our lifestyle, what we do in a day, like what we do with our patients. Let's say sometimes when the patients become like family members, it goes beyond the clinic.
Yeah.
Sometimes, right?
Yes. But I stick within the clinic.
But sometimes, like
I stick within the clinic to avoid conflict of
it's
interest.
like a professional, like alam na lang, hi, hellos, like
Maybe
certain
next
events.
time we can also address, kasi ngayon it's more about personalization of, maybe next time we can discuss in one treatment per se, so we can elaborate
maybe.
for each treatment in what we use in InMore.
Like, yes, exactly. Like, let's say maybe the polynucleotides.
Polynucleotides.
Or
We
the
can
skin
really
boosters,
discuss it.
life stimulators.
As we close our first episode, we hope today's conversation reminded you that evidence is powerful, but personalization makes it meaningful.
Because true patient care isn't one size fits all. It's informed by science, guided by experience, and shaped by the individual in front of us.
Thank you for learning and growing with us.
This has been InMore Clinical Conversations. See you in our next episode!